My name is Michelle. I'm a pharmacist with the company Upsher-Smith. And today, I just want to welcome all of you. Thank you so much for your attendance. I hope this is the first time I've been at this conference, and I have to say it is a wonderful experience to be with our people, right? People who understand the situations that we are working through on a daily basis. And I hope that it's been a good meeting for everyone so far, full of empowerment and uplifting and of course magic, right? Magic. So today I'm going to give just a quick presentation on a new product that is called Vigify. And this is a vigabatrin solution that is a ready-to-use formulation, so it does not require any mixing. I'll get into why that is important as we go through the slides here. Again, my name is Michelle. I'm a pharmacist, and I am employed by a pharmaceutical company. That company is Upsher-Smith Laboratories. We're based in Minnesota. We recently just joined forces with the company Pyros, who was bringing Vigify to market. And so if that name sounds more familiar than Upsher-Smith, that's the connection there. But yeah, we're located in Minnesota, right outside the Twin Cities, if my accent didn't give that away already. This is a promotional program. If you would like prescribing information for any of the products that I'm discussing, it is up at the front of the table here. Feel free to grab that. All right, so I'm going to start. I want to just kind of set the stage and explain why it's very exciting to be here representing Vigify today. So Vigify is a vigabatrin formulation. Vigabatrin has been on the market since 2009. Was originally approved as the brand Sabril. In it, vigabatrin has two indications. First, it is used for infantile spasms. Infantile spasms, many of you are probably familiar with this, but outside of these walls, infantile spasms is not well known because it is so rare. So there are about 2,000, you could even argue 1,500 cases diagnosed of infantile spasms per year in the United States. This is a rare seizure disorder that affects children typically between the age of 3 and 6 months is when you'll start to see onset. And the seizures don't look like normal seizures. They don't look like a tonic-clonic seizure, or they don't look like the movie seizure, I often will say. The infant will have what looks like a startle reflex, and that will happen over and over again in clusters. Those are clusters of infantile spasms. It is a seizure, and every time those seizures happen, we become very concerned because they can damage a developing brain. And so it's very critical. I would say it is a medical emergency in many ways to have those spasms stopped as soon as possible. So vigabatrin is indicated for infants 1 month to 2 years of age for infantile spasms. The primary dosage form that was used for years, since 2009, since the vigabatrin first came to market, was a powder for solution. So it came in 500 milligram packets, sachets, stick packs. I mean, it looks like kind of a Splenda package, right? That you will tear open and pour into water and then mix. And so you'll make a concentration of solution that's 50 milligrams per mil. And then the parent will draw up what they need for each dose and discard the excess. That is the traditional vigabatrin solution for infantile spasms. Vigabatrin also comes in a tablet, and that tablet has traditionally been used more commonly for patients with refractory complex partial seizures. So these are seizures that are starting in one side of the brain. They will affect consciousness to some degree. And they are refractory. That's an important distinction in this indication. So it's not a first-line drug for complex partial seizures, but for patients with refractory complex partial seizures, meaning those that have not responded well to multiple AEDs, vigabatrin can be utilized. Again, typically it'll be as a tablet. But that indication does go down to 2 for refractory complex partial seizures. And so sometimes the powder for solution would be used. Sometimes it will be in an older patient who has difficulty swallowing a tablet as well. So traditionally, these were the dosage forms we had available. So Upsher-Smith has made a commitment to bringing forward all 3 vigabatrin dosage forms as we move forward with the addition of the new product Vigifide. And so we are bringing these 3 options forward in the spirit of providing physicians, caregivers, families the ability to customize therapy to best meet the needs of each individual patient. Whether that means they are receiving a ready-to-use solution, a powder for solution, or a tablet, we will provide these products backed by exceptional service. When I talk about exceptional service, I'm referring to pharmacy support in many ways. As I said, because infantile spasms is a medical emergency, we really can't afford to have the pharmacy chewing on their insurance benefits for 2 weeks before they get the drug out the door. And so Upsher-Smith's programs are committed to rapid delivery time of drug to patients. In many cases, that means 24 hours. So with that background, I want to show you the suite of products that we'll be bringing to the market. And then from there on, we're going to focus on Vigifide because that is the newest product to enter this market. So of course, there's Vigadrone tablets on one side. That's 500 milligram tablet. Vigadrone powder is the formulation that I talked about earlier. It is powder in a sachet that you pour into water, mix, and then you drop the amount that you need for each dose. The remainder is discarded. So that's a prepare on demand in drinking water formulation. The next option is Vigifide. Vigifide is the new formulation among these 3. Vigifide was just recently approved, and what makes Vigifide unique is it is a ready-to-use solution. So for parents and caregivers who want to avoid preparing each dose prior to administration, this is a ready-to-use solution. Use an oral syringe to draw up the dose and administer exactly the dose that's needed. All 3 of these products will be folded into the Upsher-Smith support programs to ensure that exceptional pharmacy service. So just to highlight a few things about Vigifide, if you're not familiar with Vigifide, the indication again is for infantile spasms in infants 1 month to 2 years of age. There is no mixing, so this is a ready-to-use solution. It does come in a higher concentration than the traditional powder for solution. So the traditional powder for solution was a 50 milligram per mil when it was reconstituted according to the label directions. Vigifide is 100 milligrams per mil. The advantage there is if you have a patient and you're struggling to get the dose in, this is a lower volume. And so you have to give half the volume. And so that can be an advantage if that is a challenge for a caregiver. The formulation has no carbohydrates. So if you have a patient or family member on ketogenic diet, that is not a concern. It's 0 carbs per mil. And this product does have a mild sweet mint flavor. And so again, infants, they're tricky. They can detect that medication taste, right? When you think they shouldn't be able to. And so if you have an infant who has picked up on that taste and they need it masked in some way, this product has a mild mint flavor to mask that taste of medication. As far as how to use it, this is really the beauty of this product. This formulation was really designed for ease of use from start to finish. Comes as a 150 ml stock bottle. So depending what the patient's dose is, they may get multiple bottles. The bottle has a safety seal inside. So either the pharmacy or the caregiver will remove that safety seal. You can use the top of the oral syringe tip if you need to pop that open. You're going to take that off. There's going to be a syringe adapter that gets inserted into the bottle. That way if it tips over accidentally, you don't lose a lot of volume, and it also makes sure that nothing leaks out as you draw it out of the syringe with the syringe. So you'll insert the oral syringe, invert the bottle, and pull the amount that's been prescribed into that oral syringe. When you open a bottle for the first time, we're going to ask families and caregivers to note the date. The product is good for 90 days after you open the bottle. Whether you store it in the refrigerator or you store it on the shelf, it doesn't matter. So room temperature or refrigerated is fine, but 90 days shelf life. And so we're going to note that on the bottle. Any product remaining after 90 days from an open bottle should be discarded. And this walks through the remainder of the administration steps. To continue on through the differences for this formulation versus Vigadrone powder for solution or traditional vigabatrin powder for solutions, there's no medication waste with Vigafide. And so with vigabatrin powder, it was a 500 milligram sachet, and you prepare all 500 milligrams at one time. You're going to draw up what you need and discard what's left. So that is the medication waste from each dose. With Vigafide, you're just drawing out exactly what you need for your dose. Again, I mentioned it's stable for 90 days, whether you keep it in the refrigerator or on the shelf. As long as it's kept out of reach of the kiddos, you're just fine. Storage is okay either way. And then as far as contamination goes, this is a preserved formulation. So it contains preservatives so that it will avoid the microbial growth that can happen. Additionally, you're not preparing the dose each day, and so the risk of microbial growth from those preservatives and the mechanism of drying up the medication from the stock bottle is advantageous if you're concerned about that. If you are a caregiver of someone who's receiving vigabatrin powder, or you're a provider who's prescribing it and you're going to make the conversion, please be aware that the concentration of the ready-to-use Vigafide is double that of the regular powder for solution. So you're going from a concentration of 50 milligrams per ml traditionally, what we've all been familiar with for more than a decade, to 100 milligrams per ml. So there's a clinical advantage there, but you want to be cautious to make sure the providers understand that they will be drying up less liquid. You don't want anyone to click into autopilot and drop the amount they're familiar with. All right, I'm going to close with just a few mentions about safety information. And so vigabatrin, since it was approved back in 2009, has carried a boxed warning for the risk of vision loss. And the type of vision loss that can occur with vigabatrin is a tunnel vision. And so it will be a slow and insidious closing of the visual fields. And tunnel vision is kind of the casual way to describe that. It can be severe enough that it can result in disability. And so for that reason, whenever vigabatrin is prescribed, there's a careful risk-benefit analysis that goes into place so that we can ensure that the benefits do outweigh the risks of the side effect. If you are a caregiver or a family member of a patient, one of the very important things to keep in mind is there is a REMS program. REMS stands for Risk Evaluation and Mitigation Strategy for this product that is implemented and required by FDA to ensure safe and appropriate use of this medication. So when a patient is started, they'll be consented to consented to become aware of the side effects and acknowledge they understand the side effects. And very importantly, they'll be agreeing with the provider to have the patient monitored to watch out for this side effect. Now with children, the challenging thing is that it's hard to know that their visual fields are collapsing, right? And so oftentimes these patients will be referred to a neuro-ophthalmologist so they can be very closely monitored. And that is very important, this therapy, that is monitored and that everyone is aware and is watching for signs of concern. I'll say like one sign of concern, easily startling, right? So like someone snuck up on them from the side and they didn't see it because that visual field has collapsed. And so easily startling might be a sign that there's something going on there. So again, risk-benefit decision, stopping the seizures is absolutely essential to normal neurodevelopment. And so you weigh the risks and the benefits for each